And now I want to swap to something that is similar to acute coronary syndromes, but it isn't. And the reason is because if you do angiography to these patients, they have normal coronaries, okay? There's nothing special about coronaries. There's no narrowing or nothing happened over there at the moment. There's not a sudden occlusion. Because, of course, if you're having MI, you will see that suddenly the flow is stopped somewhere in the coronary, in the branch of a coronary, wherever. In this case, you do angiography and the flow is normal. But with the pain and also with a slight increase of troponins, actually, it looks like an MI, but it isn't. And it's the Takotsubo Cardiomyopathy. We talked about it a bit last time, but I want to now go through it like in more detail because I had some questions on it. So, and it's a beautiful example for you to understand the differences, the small differences. And what is Takotsubo Cardiomyopathy? It's the broken heart syndrome, and typically it happens to women. In 90% of this happens to women, and even very young women, but mostly to women after menopause, so 60 or 65 years, and it's during a serious stress. But it happens to young women as well. That's why we call it a broken heart syndrome, because typically it happens during many different stresses, but also during, let's say, a breakup. It's really described in the older women. If they're after menopause, the heart is not protected by estrogens. So it's more common. But as I said, again, it can happen to a 25-year-old woman and after a serious stress. So breakup, for example, okay? Or death of a lover, or death of someone near, or a serious illness or whatever. The cool thing about this thing is it's reversible of most of the cases, okay? And still I will tell you how it is similar to MI, but it happens to, we think it's due to increased catecholamine. And if the woman really loves someone, okay, and he breaks up with her, yeah, she can have such a serious burst that this will happen to her. And what this means is there's a dilation of the heart, of the left ventricle, sudden dilation. And why it is Takotsubo, wait a sec, I will write it down, because Tako means a octopus, and Tsubo, it's a pot or a special trap where you trap the octopuses. And it was described in year 1990, and when they saw it on angiography, I guess, they saw that it looked like, really, this is a pot, it looks like this. Suddenly the left ventricle looks like this. So basically, if I will draw a heart, if this is a left ventricle here, I will put it in red. This is a normal left ventricle, let's say. And typically the apical part here, if here's an apex, this is a right ventricle, but here's a left ventricle. Suddenly what happens? Widens like that, like a balloon. Suddenly you see it like a balloon, and the wall gets thinner. So suddenly this part, I will delete it here, that you see how thin it is. I'm sorry, so I will redraw it. So it changes, or wait a sec, I'll put it back here, and I will draw it once more here next to it. So suddenly the basal parts, the basal parts of the ventricle are up actually, and the apex suddenly dilates and gets thinner. And we think that the reason is increased burst of catecholamines. And by the way, in the apex, you got more beta receptors here. So maybe it's we don't know exactly the mechanism, but it's described. And when they first saw it in 1990, described it, they saw it looks like the jar it's a pot where you catch the octopuses. And basically, you know how they catch it? It's the nature of the octopus that they're hiding in a cave, and they get somewhere through a small opening and they get inside. But so the fishermen, they put it on a rope into the sea, and during the night the octopus will get there, and suddenly in the morning they pull it up fast, and the octopus, it's not able to turn around, so it stays there inside. Okay, so it's the nature of the octopus is to hide in such a spaces. And that's the way how to catch it. You don't put anything inside. They just get there inside. But when they saw it, the Japanese doctors, when they saw it on the angiography, it looked like this. So that's why it's called Takotsubo, because the dilated heart looks like this. Exactly. It's thin, thin around over here, and it's a ballooned reaction like this. So what type of failure you're going to have over here? We talked about it with cardiomyopathies last time. It's a systolic. Fortunately, it's only a few percent die, small percent. Fortunately, it's reversible. It's a systolic dysfunction. That means with reduced ejection fraction, because only this upper part better contracts. This lower, the apical part, is dilated and cannot. This lasts like 4 weeks, remember, after this burst of catecholamines, and then it normalizes, fortunately. But still, for example, I was checking the statistics, and over here in Czech Republic, we got like 200-300 cases of this. But anyways, what I wanted to say, that, like, maybe that's why we have gold diggers, guys. Because, I'm sure they know about the Takotsubo disease. And, if you won't get into love, you just love his money and wallet, it's okay, But anyways, I'm sure these women are really loved, so, yeah, but... That's why, like 90% is women, because, guy, if she dumps him, he does what? He buys a faster motorcycle, and it's okay. It's totally fine. So I guess women love deeper. Yeah, but gold diggers are protected. So now it's your choice, girls, which way you want to go. So anyways, according to this, you should understand there's a burst of catecholamines. And of course, we're talking about, it's called broken heart, but of course, if someone dies in a family, especially a child, as we talked, that's the worst stress. So it's described, and the important thing is 2-3% of acute coronary syndromes, they're admitted as acute coronary syndrome, so we think there's something with coronary arteries, but it's not, it's Takotsubo, okay? Because there's a pain, it's continuous pain, and there is even a ST elevation which stays there. So there's dynamics, and it really on ECG looks like a MI, ST elevation MI. So this is what you typically see on ECG, or you see ST elevation, some kind of ST elevation, and even you can see a T inversion later. We're going to talk about STEMI or ST elevation MI, and there are many aspects of it that you could think it's MI, but then you're going to do angiography, and you'll see there is no occlusion in the vessels, so the vessels are fine, and you will see dilation of the heart. You will see this balloon dilation of the mid and apical part of the heart, which fortunately, again, is reversible. So after it starts, let's say the duration is 4 weeks, and in 2-4 weeks, it's getting better and better. And suddenly, the heart very likely normalizes in most of the cases. And also, in most, not all, but in most of the cases, the ECG normalizes. Here, Takotsubo is an example of something that looks like an MI, looks like a acute coronary syndrome, but it isn't. It's pseudo acute coronary syndrome. But it will be admitted as MI. And even you have a slight increase of troponins. So again, you think it's MI, it is an MI. Or, of course, if it's increase of troponin, that means what? There's a rupture of some cells, definitely. But the initial problem, very likely, definitely it's not a serious occlusion. We don't know if there are maybe some microspasms as well, but the major thing is the burst of catecholamines and the stimulation of the beta receptors. Remember, during severe stress. So if I want to finish this, the acute coronary syndrome that we're going to talk about it next time more, or MI is about the occlusion of the vessel, okay? MI is about occlusion of the coronary artery. So it's occlusion to the heart. Takotsubo is serious stress to the heart. And it's rarer, but as I said, 200-300 people over here in Czech Republic. In total, 2% of any acute coronary syndromes, we think, or 2-3% of people admitted because of the coronary syndrome, we think it's acute coronary syndrome, and it's Takotsubo. So very interesting thing, very interesting mechanism, pathophysiological mechanism. So I guess we're going to end over here, and we're going to continue with proper MIs next time, okay? So thank you very much. Okay. Yeah. Thank you. So thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.